What is testosterone replacement therapy, or TRT? So in this video, I want to discuss the simple ways we treat someone who has low testosterone after we identify that that is the problem. We first need to get the blood test to identify what someone's hormone level is. And often, if you're going to go through something like the NHS in the UK, if you're towards the bottom of the reference range but still within it, they're very unlikely to give you treatment. However, if you go with private healthcare, from my experience, they seem to treat you when you hit that bottom end of the reference range, which is when you will start to really see the problems manifest. And that's for the average person. If you're someone who's training, you'll see a decline way earlier than that, because you're trying to gain muscle mass, lose body fat, have high energy, and generally have the complete opposite situation to someone with low testosterone. And this is why it's really noticeable for those of us that are training, more so than those of us that aren't, because we're just not going to see progress, realistically, or very good progress. So the ways we would treat it are a long-acting testosterone injection, which is often prescribed by the doctor every 3 months. In my opinion, it's a really bad way to do it. But when I've discussed this with the endocrinologist at the hospital, who has agreed to prescribe testosterone to me, he said that it's because most people don't like to inject themselves, which makes complete sense. I understand that. This is why most people like oral medication over injectable medication, because they don't want to inject themselves due to the stigma that comes with that and hardcore drug use. So we get it. Testosterone undecanoate is a very long-acting testosterone. It will spike in the body high, but then take a long time to break down. This is why it's a really poor choice to inject it every 3 months, although it's then better for the doctors because you're only going once every 3 months. It will see a huge spike in your testosterone, which will then see loads of problems come and all the side effects that come with the huge spike. It then slowly declines, but it will drop well faster than a 3-month period, and you'll end up with low testosterone again for a period of time, depending on how fast you clear the actual drug itself. You will end up with low testosterone again before you get the next injection. So you end up storing a huge hormonal fluctuation. The next injectable form, I've got an ampule for a good example. It's a pharmaceutical ampule, so this would snap. This is 1 milliliter. But again, a poor choice, because if you were to use 1 milliliter in one go, you still get a huge spike and then a decline. With that huge spike is when we get the side effects. In my opinion, 250 milligrams is too high for anyone on a TRT. Even for myself, I clear testosterone very quickly, as shown by my blood tests. Extremely quick compared to the average person. Some people actually clear it very slowly, so they would get enough of a replacement off a lower dosage because it's not being cleared as fast as it's been put in. For me, it clears really quickly. We've seen that. I've finished a bodybuilding competition, for example, and we've seen a massive decline in just 1 week, which should take at least 3 to 4 weeks for the average person. So we've seen and collected that data to know a little bit more clearly for me specifically. 250 milligrams is still too high for me. I could try and justify that as a bodybuilder to say that, well, I've got a high level of muscle mass and I need more, but I'm still also trying to justify a higher usage because I want to take more, not because I actually need to take more, and that's something that you guys need to be aware of. The odd person does prescribe himself a TRT at 250 milligrams, but you're not actually at TRT. For most people, that will see them well over the reference range and start to stress their health, which means it's not hormone replacement, it's not mimicking natural levels. Even if you want a high natural level, you want to be towards the top of the reference range, if you see an impact on your health, then you're not on TRT, you are now just blasting, and you're on a steroid course, realistically. That is a topic for another day, separating the two, medical usage, steroid usage. Testosterone is used in both, so that's why there's some confusion. But we're just talking simply medical replacement here. Medical replacement, how we can treat someone who has clinically low testosterone to get them back into a healthy place to live a healthy life. I would like someone to be towards the top of the reference range, because I'm trying to see them not just be healthy, but to perform well in the gym, be the best self, have high energy, perform highly, and just be kind of the top we can really be. The doctor isn't concerned with that, they're just trying to get you up to sort of midpoint of the healthy range. So that's why I would often want someone to be slightly higher. But we understand the difference is why. This is not to be confused with bodybuilders trying to justify drug use. That is a different thing altogether. There's a lot of bodybuilders who would quite easily recover the natural hormone production and have a more than adequate level, but they're in a situation where they don't want to. I was also one of those people. So I've now got to a point where I can't recover to an adequate level, but in the past I actually could, but decided to stay on a lower level of testosterone in between the blasts anyway, because I was pursuing bodybuilding. At the moment, that's not the case, and we're talking medical replacement. One of the last things we've got is a testosterone gel. I personally don't like testosterone gel, but I understand why some people would use it, because people don't like to inject themselves, obviously. So some people may go to something like a testosterone gel, which you'd have to apply every day. The active life of this is very short, so that's why we're having to apply it every single day, or you will see a big drop off. So it doesn't leave as much margin for error. With the injections, you could use this once a week. I would tend to say twice a week is better. It sees a more steady hormone level. You could argue that the gel is more closely to natural production because it's kind of going to spike every day. It's not going to spike very high because you're not going to take as much. But per milligram, you would need more. So each sachet, this is 10 milligrams. You would need more across the week to get the same level because it's a cream, not injection. Injection is going to be put in and you're going to get 100% bioavailability. So it gets 100% of what it's supposed to. Gel, not so much because you're going to lose some of the bioavailability due to the fact it's a gel, not an injection. Injection is just go 100% straight away. So these are just things that most people are not quite understanding when they're trying to maybe get testosterone replacement. And it's also understanding, do we need it? A lot of people will say, I want to go on TRT, not really understanding what it is, and not actually having a medical problem. We're seeing a lot of younger guys do it now. And don't get me wrong, I have seen some younger guys who have low testosterone who genuinely have a medical reason to take it. But I've also seen some young guys that just generally want to take it to, again, justify their drug use. I can't say either is right or wrong. It's completely their body and it's their choice. If they're self-administering, then it's completely their choice. The main thing is understanding if we're trying to actually say it's for a medical reason and we're trying to then be healthier, because lower testosterone is more unhealthy than having a high normal level. But if we go above that, we start to then go back the other way and we see a negative impact again, which is why it's really important to know what kind of dosage are we looking at. For most people, it's between sort of 125 and 175 milligrams per week. I would say if it's a testosterone anthem, it's split into 2 doses. The testosterone decanate, I don't really personally feel is a good choice due to the fact of this big gap, and we're going to go huge spike coming down. I would like that to be given more frequently. If you're going to go that same dosage, same time frame, just go more frequent. It'd make much more sense. But when I spoke to the endocrinologist, he said we can't give it to you. The nurse has to inject you with it. So I think they do 4 milliliters in one go into one muscle, which is ridiculous from my experience doing this stuff. But you understand why they're administering it in that way, because most people wouldn't like to inject. So in that case, it's best choice because that's the best way to do it. We can't have people coming in every single week to be getting testosterone injections. That just wouldn't be possible on the NHS. So the best thing you can do, in my experience, is to have the injection yourself and just get over the fact that you've got to inject for the rest of your life. It's a medical problem. There's lots of people with medical problems that they have to inject medications. Diabetics, for example, yes, I know using insulin is less invasive, but they have to inject and they don't want to. Some people turn around and go, I don't want to inject, I don't want to take insulin, I don't want to test my blood sugar all the time. Unfortunately, you have a medical problem and it's just the way it is. If you want to be healthy and actually continue living a healthy life, then you have to do this. If you don't and you're not bothered, then this conversation doesn't really matter. But if you are bothered, then this is the choices presented to us. The thing that we often see is people would rather go for an oral medication where they can. You have to understand the orals, every oral medication will carry a level of toxicity that the injections don't. So long term, it's going to have a big impact on your body, the injections. The other side of things, fertility, blood test results, health markers, and everything else, we're going to discuss in other videos. And we're also going to discuss you ladies in other videos as well, because testosterone is really important for everyone, because it does the same thing for everyone. Guys, if you found this video helpful, please do like it, drop a comment, send it to someone who you feel would really benefit from it. And that's what I ask the most. Really trying to share these videos to people that will benefit. If you can really help the algorithm by liking and commenting, that also helps too, because more people will get the chance to see these videos and then potentially change their life. Realising finally that they have a problem that is completely treatable, that they've probably been at a loss with for a very long time. So I'll catch you on the next one.